Hi everyone, my name is Jess Berg and I am an occupational therapy student completing my doctoral capstone at the American Stroke Foundation. In this presentation, we will be discussing strategies to diffuse and prevent family conflict as a caregiver. When a person suffers from stroke, it is not only the person with stroke that is impacted by the event, but the entire family. Providing care for a loved one can bring about differences in opinion in regard to care and recovery of the person with stroke, resulting in conflict. Each person impacted by stroke handles grief, change, and stress differently, which can prove to be challenging to navigate. Family conflict is very common post-stroke. There can be a big discrepancy between the expectations of person with stroke's recovery between caregivers and other family members involved or not involved in care. This can happen between a variety of relationships within the family. Marital issues can also arise post-stroke. A study found that short-term relationships, less than 5 years, were at the highest risk of divorce post-stroke. The person with stroke either felt that they were holding their spouse back or conflict was high. Spouses also report feeling as if they are living with a stranger, sometimes due to the cognitive, emotional, and behavioral issues present in the care recipient. Supportive family relationships were seen as essential for stroke survivors' survival and recovery. Family is a life buoy, so it is so important to stick together. In the following slides, I will discuss some helpful general tips on how to diffuse family conflict post-stroke. One of the first ways to diffuse or prevent family conflict is to identify what the specific issue is. What exactly is it that is creating the disagreement? Once that is identified, it is important to be honest. Express how you are feeling. Are you sad, confused, stressed, frustrated? Once you identify that feeling, take steps to resolve it between you and whoever the conflict is arising between. Also, try your best to use I statements. This avoids placing blame on others and creating increased tension. Listen to others' opinions and ideas and value them even if you do not necessarily agree with them. It is important to look at ideas and points from all directions and individuals. Considering counseling is also another viable option to diffuse and prevent family conflict. Having a third party actively listen to you and your care partner's concerns can help you both approach and resolve issues in a constructive and smooth way. Lastly, sharing responsibility is important in caring for a person with stroke. As a main caregiver, it is important to involve other family members in care to provide needed rest and recuperation for yourself. Role overload is common with caregiving and can be avoided working as a team to care for your loved one. Creating a care schedule and communication can assist in the venture of sharing care responsibilities. There are also some other ways to diffuse or prevent family conflict. First, blame the disease, not the person. Remember that it is the stroke itself that may have caused personality and behavioral changes in your loved one. Step back and look at the larger picture. Sometimes we all get caught up in small or trivial problems when we should focus on important bigger picture goals. Also, as a caregiver, it is important to build in rest breaks, thus respite care is a great option to prevent family conflict. Taking a break from your daily duties as a caregiver can boost your morale and spirit. One of the key ways to prevent family conflict is to actively listen during conversations surrounding that conflict. Pay attention to body language and do your best not to interrupt until the other party's concerns are heard and concluded. We often miss out on what others are saying simply because our mind is preparing for a rebuttal, or we tune them out because it is something that we do not want to hear or acknowledge. Being an active listener helps you understand the other party's concern and respond appropriately and constructively. This is something both parties should do during family conflict or disagreement. Lastly, schedule time to communicate with your family. It is difficult to resolve an issue or have a conversation with someone when they are in the middle of another task or mentally or not in the conversation. It is also important to avoid assuming you know what the other person is thinking, concerned about, or knows about the situation. Be clear. Always specifically state what each of your roles are in the caregiving process, what the schedule is, and what are priorities for your loved one. Do your best to steer away from strong emotions during important conversations about the person with stroke's care and well-being. If something is said or done that sparks a strong negative emotion, do your best to apologize for eliciting that reaction and reconvene when everyone is calm. Lastly, schedule family meetings to keep everyone up to date on the caregiving process for the person with stroke. I have already discussed general tips for families to diffuse or prevent caregiver conflict. However, the literature has cited specific tips for siblings caring for their parents as well. For siblings involved in the caregiving process, it is important to work together and communicate effectively so that your parents are taken care of and you yourself are taken care of as well. First, come to a consensus by having meetings in person or over video calls or phone calls to keep everyone in the loop about your parent's condition. Devise a plan to share responsibilities and who is responsible for each caregiving role. Try to stay in touch often and to reevaluate each person's role every 4 months or so to see how they are feeling, communicate any concerns, and check on their well-being. Be sure you are communicating effectively with your siblings and asking for what you need to ensure a good quality of life for you and the care recipient. Don't assume your siblings can read your mind. Be vocal about what you need. If the task of caregiving is causing too much strain and decreased quality of life for you and your siblings, consider outside help, such as respite care. This could help alleviate some of the burden on yourselves and allow you to take much needed time for yourself. Being a caregiver can also cause strain between you and your spouse or partner, even if they are not the person with stroke. Here are some tips for spouses and partners to avoid family conflict during the caregiving process. When caring for a parent post-stroke, your spouse or partner could feel that your relationship has been put on the back burner as you spend more time with the care recipient. This could cause conflict and ill feelings towards one another and jeopardize your relationship. In order to avoid conflict, the literature suggests that you both discuss expectations frequently. Role shifts are inevitably going to occur as you take care of your parent and your own household. Do your best to keep communication open and outline expectations. Be available for time together and schedule in date nights or doing an activity that you both enjoy together each week. The caregiving process could also be made easier on yourself if you enlist your spouse's help. They could either take on more responsibility in your own home, like cleaning, grocery shopping, or running errands, or they can help assist you with some caregiving tasks so you aren't spread so thinly. Lastly, make sure you keep communication open. Check in on each other often and be aware of the emotional strain caregiving can have on your relationship. One in 8 Americans between the age of 40 to 60 are raising children and taking care of a parent or relative at the same time. This demographic of caregivers is called the sandwich generation due to the fact that they are a generation sandwiched between two caregiving roles. Parents who are in this role can have concerns about splitting time between these two roles and the impact it could have on their children. Here are some specific tips for parents to reduce the impact of caregiving on your children. First, realize you do not need to be perfect, and your children and care recipient do not need you to be. They just need you to be loving and supportive. Do your best to preserve family life by dedicating specific times to your children, such as bedtime routines and meal times together. Also, involve your kids in appropriate ways in regard to the caregiving process. This will help them feel as if they are valued and contributing. Teenagers can help run errands and prepare meals. Make sure to thank your children and give them praise for their help. Communicate with your children as well and let their voices be heard about their feelings towards the situation. Keep them updated on the caregiving situation to an extent and allow them to tell you how they are feeling if they're feeling frustrated or confused about the situation. Lastly, if you have multiple children, make a point to dedicate time to each child. This way you can assure that they remain foremost in your mind as you juggle caring for your parent at the same time. This could be in the form of weekly outings, walks, arts and crafts, or any activity that you may both enjoy. Conflict can also arise between yourself as the caregiver and the care recipient. Here are some tips on how to protect your relationship with the care recipient. Keep an open line of communication and respect your care recipient's wishes. Let them make decisions when they are able so they have a sense of autonomy and say in their day-to-day lives and health outcomes. Let your loved one do as much as they are physically, emotionally, and cognitively capable of doing. This will increase both of your qualities of life and decrease caregiver burden. Make adjustments to activities that you and your loved one did prior to the stroke. This may require adapting cooking tasks, shortening walks, purchasing adaptive equipment, or just adjusting expectations. Remind your loved one that there is strength in numbers for the caregiving process, and while they may require increased help or help from multiple individuals to complete tasks, you are just trying to keep them safe and as independent as possible. Lastly, do your best to find sources of positivity in your day-to-day lives. Try new activities that you may have not done before, celebrate the little victories, and share positive thoughts and affirmations. These can all boost you and your loved one's mood and strengthen your connection. Keep in mind that family conflict post-stroke will likely occur. However, using these tips in the presentation can allow for prevention of conflict or suggestions on ways to diffuse it. Always practice active listening and understanding when conflict arises. Do your best to remain calm and come to a consensus. Prioritize your relationships outside of caregiving and carve out time for them as well. Lastly, communicate care as a team. Let your care team know how you are feeling if any issues arise, and frequently check in on them as well. Here are the resources I used for the presentation. I hope you found this helpful and informative. Have a wonderful day.